If you're experiencing pain or discomfort in your upper back right between the shoulder blade and the spine, I'm going to show you the two most effective exercises and positions that have helped me actually get rid of this pain. There's been so many times I've released it, but then the pain tends to come back. But I'm going to show you how to release it, but then a breathing strategy to continually decompress your rib cage and that area so that you can actually stay out of this pain. We have to understand what is the foundation for our shoulders, our shoulder blades, our head and our neck. And this is the rib cage. And what helps support the rib cage is our diaphragm. This is probably the biggest postural muscle in our body that is well overlooked. If we have certain compression sites because we're compressed, we're lateralized to one side, we are hunched over, or we have too much flexion in the spine, this causes too much compression in certain areas of the back. Now, if we're talking about that area between the shoulder blades and the spine that's hard to reach, and you always want to get a massage to release that area, we need to first look at the rib cage as a whole. Are we actually breathing effectively to continually decompress the rib cage? So your diaphragm, as you inhale, it's this plate of muscle, it moves down and our entire rib cage should be expanding. When it expands, guess what? We're decompressing the rib cage. That is the very first thing that we need to address and to understand. So that's going to be an exercise I'm going to be showing you. But then we're going to get more specific and intentional with where we want to position a rolled up towel, which I'll show you in a moment, to really get into that area, decompress, but then train our brain and our breath to constantly breathe in this area so that pain doesn't continually come back. I'm going to be addressing all of this, and let's get started with our first exercise. The first exercise will be a breathing exercise, and we need to accomplish this and understand this as this feeds into our second exercise. So first thing, we're going to be in a quadruped position like this. Now our shoulder blades, as they track over the spine, a really important postural muscle for the shoulder blades is also the serratus, which helps us to protract the shoulder blades and push the shoulder blades further away from the spine. This is an action we're going to want to do to help create more space in the back part of the rib cage. Let's do a big exhale. For this purpose, you can exhale and sigh through your mouth. And I want you to exhale as much as you possibly can. So you start feeling some side oblique and side ab engagement to lock those lower ribs down. We want to hold that rib cage down so that when we inhale, we're actually breathing more so through the back. It's unbelievable how much space and room we have in our rib cage to breathe through the back compared to the front. So now when you inhale, you might even be able to see this on my back, that my back should be expanding. So gently just push those shoulder blades away from the spine. Exhale fully. Feel those side abs engage. Hold and lock that into place. You may feel a slight posterior tilt of your pelvis, which is good. Keep those low ribs down. And then when we're here, inhale as we have this locked down to expand the back. Gently keep pushing those shoulder blades further away from the spine. Keep the neck and the head so that you're just gazing gently at the floor. Try not to engage the neck as you inhale. You'll obviously feel the posterior neck muscles kicking on just to stabilize. But let's do this again. Exhale fully. Keep exhaling. The more you exhale, the more leverage you have to inhale. This may take you a few times, so do not get frustrated with this. Feel the expansion happening from more of the mid-lower to traveling up higher and higher towards your shoulder blades, even to the upper portion of your rib cage. And you should feel a stretch happening in your back portion of your rib cage, and that's really good. The more you practice this, you're going to notice that you're constantly decompressing those ribs as you inhale. So once we start to train our mind to our diaphragm to breathe this way, then when you're at a desk or you're walking around or doing anything, you're going to start to unconsciously breathe this way to constantly decompress those ribs. Make sure that you perform 5 to 8 breaths like that and do at least 2, maybe even 3 sets. And then let's move on to the next exercise where you will need a rolled up towel. With that first exercise, when we were in that quadruped position and I told you to protract your shoulder blades, you are reaching your shoulder blades further away from your spine to help create more space between the spine and the shoulder blade. That's such an important factor and thing to note because we're going to be implementing this with our next exercise. Now, let's say that you have more of that pain or tension on the left side. You're going to be positioning the towel between your spine and your left shoulder blade. If you're feeling it on the right, it'll be between your right shoulder blade and your spine. So I'm going to demonstrate on the left side, so between the left spine and shoulder blade, and I'm going to have this positioned literally right in that area like this. So the towel will be vertical and nice and slow. Get into this. It's nice because we're not using necessarily a hard object. We're using a towel to start. So now what we want to do is implement what we learned. So we're going to reach now with that left arm up towards the ceiling. If you want a pillow or something to support your head and your neck, you can absolutely do that. I'm just going to be using my right hand behind my head, and then I'm pushing away, and I'm already feeling that expansion and more of the tissue pulling and pushing into the towel like this. I'm on my feet like this, I'm supported. Optional, you can lift your pelvis off of the floor slightly. That's just going to add a little bit more pressure. But now what's going to be great is once we're here and reaching, you can slightly tilt and rotate just slightly, not a lot, your rib cage and your hips to the left, because when we move our rib cage to the left, our spine in the back is moving to the right, it's pointing more to the right. So that's creating more space between the spine and the shoulder blade. And we want to create a lot of expansion here. You can even just slightly bring your right arm to the right just to pull that shoulder blade further away from the spine. And now we want to incorporate that breathing technique. Exhale fully. Feel those low ribs come down. You should feel your pelvis tilting posteriorly slightly. And let's lock that into place. Make sure you feel some slight side ab oblique engagement here. That's locking you in place. And then inhale through those back ribs. As you inhale, like I feel directly that the breath is going exactly where the towel is because I have manipulated the way that my rib cage and shoulder blades are oriented to bias more expansion in that area. So we'll be taking 5 to 8 breaths here, and you can move around slightly just to feel more pressure. If you want more pressure a little bit higher, then orient yourself a little bit different. So spend about 5 to 8 breaths there. If you're feeling it on both sides, do the exact same thing on the right side. So it's between the right shoulder blade and the spine, and then you're just going to be turning over to the other direction, so slightly to the right. You're protracting that shoulder blade and you're creating that expansion. The key here is optimizing the diaphragm and the breath, locking it down, and then engaging the diaphragm as you inhale to decompress the rib cage. When we implement reaches, when we implement a tool like a rolled up towel, this is going to help decompress externally, where your breath and your diaphragm is going to start decompressing from it more of an internal perspective. So we're getting that outside and inside heat to decompress. The more we can train our breath like this, the more effectively we can continually decompress our ribs. This is a technique you could really use throughout the entire rib cage, but try this out, perform 5 to 8 breaths and do 2 sets minimum with the towel, and then let me know in the comments below if that helps.